Hi, I'm Alex. In this poster, we're going to look at the physiological basis of phenylketonuria and also what are the treatment methods in order to reduce some of the negative consequences associated with it. So to start us off, what is phenylketonuria or PKU? PKU is a genetic disorder which requires both of the child's parents to have the gene passed on to the child. PKU is a lack of the enzyme phenylalanine hydroxylase, which is responsible in converting phenylalanine into the amino acid tyrosine. As phenylalanine isn't metabolized, it builds up in the blood where it can have negative consequences. So this does lead to a variety of neurological impairments, such as learning and behavioural deficits. Okay, so there are two different mechanisms for which PKU can affect the learning and behaviour of an individual. So the first of these is white matter abnormalities, and the second is prefrontal cortex abnormalities, which are associated with. Okay, so first we'll take a quick look at some of the white matter abnormalities. So these white matter abnormalities experienced by people with PKU are due to myelination impairments. And these are a result of the oligodendrocyte sensitivity to high phenylalanine and low tyrosine levels. The oligodendrocytes, of course, being the glia cells which are responsible for the myelination of neurons within the central nervous system. So people with PKU often experience white matter loss, cortical diffuse atrophy, as well as decreased dendrite arborization. They also do have a slower processing speed, which is also likely to be a result of the myelination impairments. Okay, so now we're going to have a look at some of the prefrontal cortex dysfunction and how that's affected by neurotransmitter deficiencies. So this actually arises from two different ways. So first of all is because phenylalanine is a large neutral amino acid, or LNAA. It also competes with other LNAs for transport across the blood-brain barrier. Now, of course, when there's a high phenylalanine level, it's going to provide a lot of competition and prevent other large neutral amino acids from being uptaken and being able to cross the blood-brain barrier. If these LNAs aren't absorbed in sufficient quantities, they're not going to be able to cross the blood-brain barrier and be used by the brain. Okay, so the second way in which prefrontal cortex dysfunction arises as a result of neurotransmitter deficiencies is due to the inability to convert phenylalanine to tyrosine due to a lack of PAH, as we discussed earlier. So tyrosine is a precursor for dopamine, and without phenylalanine being metabolized into tyrosine, dopamine isn't going to be synthesized from tyrosine. So because of this, there'll be a lower dopamine level. So dopamine is important in the functioning of neurons involved in executive functions, and with a lower level of this, these functions are going to suffer. So the cognitive impairments experienced by those with PKU are a cumulative result of both the inability to reduce phenylalanine to tyrosine, as well as the competition with phenylalanine and other LNAs. Alright, so now that we've discussed some of the mechanisms for how PKU can affect an individual, we look at a few of the treatment methods that are used to reduce some of the negative effects associated with PKU. So first up we have diet. So diet is the primary method of minimizing the negative impacts that PKU can have, and it involves the introduction of a low phenylalanine diet. So as phenylalanine is not being ingested, it can't build up in the bloodstream. So newborns are screened shortly after birth to make sure that they don't have PKU. If they do, these low phenylalanine diets will be introduced. It has been suggested by some in the past that it was acceptable to resume a normal diet once a person had reached their teenage years. However, these people did show some impairments, so it may be helpful that to see the low phenylalanine diet as a diet for life. Or even with the introduction of a low phenylalanine diet, people with PKU still do experience some subtle differences, such as a slightly lower IQ and impairments in cognitive functions, particularly executive functions, even after a diet. Okay, so we might have a bit of a look at some pharmacological interventions. So this is done through the application of sapropterin dihydrochloride, which is a synthetic form of tetrahydrobiopterin, or BH4. BH4 is a cofactor for PAH and helps in the metabolism of phenylalanine. However, the exact mechanism for how this works isn't known. It's possible that it's due to the increased folding conformation of PAH molecules, which increases phenylalanine catabolism. This has been shown to lead to improved behaviour as well as improvements in executive functioning. Okay, so in conclusion, if not managed well, high phenylalanine levels can have a negative consequence on cognitive functioning within an individual. This can be minimised by adhering to a diet which largely negates most of the negative consequences associated with PKU. And the use of BH4 may also have positive impacts for some people, but its efficacy really depends on the individual. So it will work better for some than it will for others. It may work really well for some, but it may not work at all for other people. Okay, thank you.